Welcome to my dad's show, ColdLaser.tv.
Thank you for joining us for today's episode of the Dr. Todd Show and ColdLaser.tv. I'm today's guest host, Jackie Rakers, and also a patient of Dr. Todd. Joining us today is Dr. Todd Austin. Welcome, Todd.
Thank you, Jackie. Appreciate it.
Dr. Austin is a 21-year veteran chiropractic, in addition to being a cold laser therapist for 9.5 years. Today we're going to discuss how cold laser therapy accelerates the healing recovery processes in injuries. Dr. Todd, do you find patients get quicker relief with cold laser therapy?
I really do, Jackie. It's pretty amazing, actually. I was just talking with a younger chiropractor earlier today. She graduated 20 years to the month after I did, and we were talking about, when I started out, which is how she is now, because she doesn't do cold lasers yet in her practice, but a third of the patients after their first adjustment, if all we do is chiropractic, a third of them after their first adjustment feel better, a third of them don't feel any change at all, and the third of them actually feel worse after their first adjustment before they feel better.
Okay.
So 2/3 of the people after their first adjustment are not going to feel better. And sometimes in the old days when I was just doing chiropractic, we might have a patient that didn't feel any better for 6 or 7 visits. And I'd have to keep talking them off the ledge. Well, maybe I need surgery or something. No, we just got to get this time to heal. And so chiropractic's great, as you and I can both attest to, but sometimes it just takes time. And so with cold lasers, what I've found is 85% of my patients, whether I adjusted them or not that particular visit, 85% of them will feel noticeable relief within 3 to 4 hours, which is pretty amazing.
And a huge difference.
Pretty amazing. So now, after the first 3 to 4 hours after the first visit, 85% of the people are going to know that what I did that day helped. And to me, that's a tremendous difference versus just using chiropractic without the cold laser.
Absolutely. Absolutely. Well, in layman's terms, how does cold laser therapy actually work?
Okay, cold laser therapy actually works, Jackie, that's a good question, by using specialized healing light photons of energy. So it's light. If we're talking about visible red lasers, we can actually see the light, it's red. If we're talking about infrared lasers, we can't see the light, but it's still red. Just the human eye can't detect it, it's red. It looks invisible to us, okay? So it depends on where it is on the wavelength, the spectrum. But what happens is when those units of light energy, which we call photons, get inside the body, and based on the wavelength we're using, it depends on how deep we can get into the body with those photons. Some we can get 1 centimeter deep, others we can get 2 inches deep. And 2 inches is 5
That's
centimeters.
based on the size of the lasers, is how they can penetrate a little
Really
deeper?
that's based on the actual wavelength and how much power is behind it to drive them. How far can that power drive them? But it's dependent on the wavelength to some degree.
That makes sense.
So what happens is, as a cold laser therapist, honestly, I'm really a matchmaker between laser light photons and my target tissues and cells. I have to hook up the right wavelength of light with the right power behind it to get it to the cells to produce the healing effect. So that's what I perceive my job to be there. So the way that it actually works is that when those laser light photons interact with the cells, now if they interact with healthy cells, they simply give them more energy. Okay, so we have a cell now that has more energy. If they interact with unhealthy cells, they still give them more energy, but they also do a plethora of other wonderful things. So they increase the body's ability to heal, so they speed up the healing process. They reduce pain, swelling, edema, and inflammation. They increase range of motion. So like if we had a shoulder issue, we could only move it here. After a cold laser treatment, we're able to have more motion, able to lift it up high. So it does all those things. My favorite thing that the cold laser therapy does, though, is it increases the once damaged tissue's ability to handle additional stress. So if you're an athlete, you sprained your hamstring playing football, Well, guess what? Once we get you done, we're going to send you back out there, and you're probably going to play football again. So you're going to reintroduce those same stressors that caused you to have a problem in the first place. And so the cold laser therapy can actually heal things at the cellular level, and that's why these people, why it increases that once damaged tissue's ability to handle that additional stress without us having a bunch of subsequent injuries.
Wow, so not only are they recovering and seeing the effects faster, they're able to return to their normal lives.
Exactly, return to normal life and then not have to worry about all that. We have a weak area. I mean, if we didn't do cold lasers, we might have a weak calf or weak hamstring for the rest of our life, unless we gave up that sport that we love.
Right. And most humans nowadays all think that they can't have downtime, so
true,
it's great to be able to get right back.
Stuff in that capacity.
What a great avenue for you. So, can you tell me a few examples of the few challenging conditions that you have found that the cold laser have actually improved the healing process?
Yes, I was talking once again with a younger chiropractor, and that chiropractor was sharing examples of things that they didn't like to see in their office, which was knee pain, shoulder pain, and fibromyalgia.
Big challenges in your
And
role.
I look back and 20 years ago, heck, even 10 years ago, I cringed when a new patient called and they had a knee pain or a shoulder pain or fibromyalgia because I sucked at this. I just flat out was no good at it. And I would have rather just gone to someone else because I don't like to not succeed. I like to be successful and I like to help people. And I don't like to spin my wheels. So with the cold lasers, I love working with those three conditions, and so I was telling this other chiropractor, that's the amazing thing about this, is now I love those three. Yes, bringing all the knee pains and all the shoulder pains and all the fibromyalgias, and I want to, I feel confident that I can help those people to the best of my abilities and give them some pretty rapid relief versus very minimal relief before I discovered cold laser therapy. So pretty awesome to be able to change a lot of lives that I was not able to change before.
Right. I'm a huge believer. I was training for my first 5K and unfortunately had an injury. And I came to Dr. Todd, had cold laser therapy. I was able to continue my training and able to complete my first 5K. So I know from experience that it works, and I'm a huge believer in it. I hope you've gained a little bit of information today that will enable you to focus in on what cold laser therapy can do for you as well. Thank you for joining us, and we hope to look forward to you joining another episode of the Dr. Todd Show and ColdLaser.tv.